Have you ever been sitting on the floor watching your baby babble happily and suddenly felt a quiet panic? Why aren't they saying words yet? That feeling lands deep because hearing your child speak feels like proof everything is unfolding right. That worry is real, and it deserves a calm answer. Most parents I work with have the same knot. You compare milestones, hear about early talkers at playgroup, or read lists that make normal variation feel like failure. You ask your pediatrician the same question and leave hoping for certainty. That pressure is exhausting, and it makes every silent minute feel longer than it is. So let's reframe the pause. Not speaking yet is usually not a problem. It's an in-progress stage. Words are the visible product of months of hidden development. Hearing refinement, oral motor practice, attention control, and social back and forth. Often the most important work is happening beneath the quiet surface. Here's what the baby brain is doing right now. From birth, infants tune to speech rhythm and to the faces that speak. The auditory cortex is sorting the building blocks of language, phonemes and intonation, while motor pathways in the mouth and tongue learn patterns through babble. Social circuits are being trained too. When a baby coos and you respond, reward systems strengthen the link between sound and social outcome. Those repeated cycles, sound, response, pause, repeat, are wiring vocabulary, grammar, and conversational timing long before a first clear word. Developmentally, there's a sensible arc. Newborns show attention to voices and can calm to a familiar tone. By 3 to 6 months, vowel-like coos and longer attention spans appear. Around 6 to 9 months, canonical babbling gives babies practice with consonant-vowel combinations. Between 9 and 18 months, gestures increase and proto-words emerge, soon followed by real words and then two-word combinations. However, babies vary. Some invest early energy in crawling or fine motor skills and talk later. Others focus on social cues, then language. Prematurity, bilingual environments, and temperament all shift timing without signaling disorder. What practical steps move the system forward gently and effectively without pressure? First, make language interactive. Narrate what you do in short, clear phrases. Milk, sip sip, up hug, and then pause for 2 beats. That pause is practice time. It invites your baby to try a sound back and rewards trying. Second, treat babble like conversation. Mirror their sounds exactly. Then add one small change. If they say ba, return ba ba. Wait. These micro conversations train turn-taking and timing, essentials of real speech. Third, create focused language windows. 2 to 5 minutes of no screen, no distraction talk during feeds, diaper changes or walks. Quality-focused input beats longer, distracted exposure. Fourth, highlight mouth and gesture. Get close, slow your mouth shapes, use exaggerated but natural expressions, and pair words with visible actions and touching the named object. Multi-sensory pairing helps the brain bind sound to meaning. Fifth, expand rather than correct. If your child says ba for bottle, respond, yes, bottle, bottle for you. Expansion models the next step without pressure and shows how single sounds map to longer, meaningful words. If you notice red flags, very limited babbling by 9 to 12 months, minimal eye contact, little response to name, or concerns about hearing, reach out to your pediatrician for a hearing check and developmental screen. Early evaluation is simple and powerful. When there is a delay, early intervention changes trajectories. Remember, most children progress on their own schedule, and your calm presence is the single most powerful tool. The small, ordinary habits, narrating, pausing, mirroring, and expanding, are the daily practice rounds that turn babble into conversation. Try this tomorrow. Choose 2 brief moments to narrate with a pause and mirror any sound you hear. Notice what changes over a week. If this helped, save the video and share it with another parent who's worried about speech. Subscribe for more warm, science-backed ways to understand your baby's growing mind, one small sound at a time.